As we mentioned, the government funding bill passed out of the Senate does not include Affordable Care Act tax credit extensions Democrats had been demanding. If these are allowed to expire, it could have a major effect on health insurance premiums. KOMU 8's Nathan Lee is here to explain how it's not just people reliant on affordable health care who could end up footing the bill for this.
Yeah, that's right, John. We're talking about tax credits that cover more than 24 million people across the country. They expire at the end of the year if Congress doesn't sign extensions for the credits. And it comes during expensive times for insurance. Experts told me today that nearly every company is raising their monthly rates in 2026.
On this vote, the yeas are 60 and the nays are 40.
In a deal to reopen Washington,
people are going to be stuck between a rock and a hard place.
Key tax credits on the chopping block.
Costs are going to go up across the board for everybody.
And by the way it looks in Missouri,
they're going to have a little bit of sticker shock this year.
Some, like Cox Health Plans or Medica, up to 30%.
This year, we're really seeing a lot of different factors kind of culminating together.
Department of Commerce and Insurance Director Angela Nelson says it was inevitable.
As we have to pay doctors and nurses more, which they deserve for the services they provide, as medications increase in price, as all things do, those also compound into higher rates.
For the independently assured, like small business owners, they'll be hit with the full bill, especially if ACA credits are left behind.
They help keep the costs down.
For the more than 417,000 Missourians covered by ACA,
they can't afford a doubling potentially of costs for their health insurance on top of that.
Rural Health Association Executive Director Heidi Lucas says without them,
they'll have to make a choice, right? It's a matter of, do they have it in their budget to have their costs increase 30%, 40%, 50%, 100%.
Right now, it's a waiting game.
We just don't know what is going to happen, but I think the best and most prudent path is to get a plan now, because if you don't, you're not going to have an option to go back and buy that plan after January 15th.
Even through the soaring rates, Nelson and Lucas agree.
Health insurance is just too important. Catastrophic things can happen. You can be healthy one day, be in a car wreck, get drastically sick the next day.
There's always a higher price to pay.
You never know what might happen. Life happens all the time.
Again, the House still has to pass this bill through before the government reopens. There's also the promise of debate on ACA happening in December. We'll make sure to keep you updated as the votes keep rolling in. In the studio, Nathan Lee, KOMU 8 News.